According to the American Cancer Society, there is over a 40% chance that a person born in 2013 will contract some form of cancer over their lifetime. Billions of dollars are spent on cancer research each year. We have found some treatments, for example, chemotherapy, surgery, bone marrow transplantation, and radiation therapy. However, these treatments are invasive and toxic, physically painful, and often inflict long-term damage on the patient. Immunotherapy is an innovative treatment that involves using the body's own immune system to better detect and fight cancerous cells. One major type of immunotherapy is the use of monoclonal antibodies. An antibody is a protein that binds to a specific antigen on a cell in order to mark that cell for foreign object-eating white blood cells called phagocytes. These can be used to target cancer cells. Scientists researching this mechanism have found a way to use one antibody, the anti-CD47 antibody, to target all types of cancer. CD47 is a protein located on almost all body cells that inhibits immune attack on those cells. Because of this, phagocytes are able to differentiate between body cells and foreign cells and attack accordingly. Theoretically, this should mean that the phagocytes can find and destroy tumors. However, cancerous cells have developed a survival mechanism that entails developing even more CD47 on their membranes than healthy body cells. Fortunately, we can capitalize on this. Here's how it works. First, the antigen CD47 is introduced in a host animal, which develops a B cell that produces the corresponding antibody, anti-CD47, through its adaptive immune response. Then, a sample of B cells is harvested from the spleen and mixed with myeloma cells, a type of cancer cell that can divide uninhibited. The B cells and myeloma cells are fused and together form hybridoma cells. The cells are then cultured in a solution in which only the hybridomas can survive. The new cells are separated and tested for anti-CD47 antibody so that the cell that produces the correct antibody can be identified. This cell is separated and cultured, and the antibodies it produces, called monoclonal antibodies, are extracted. The antibodies are now administered to the patient. They bind with their receptor sites on the CD47 antigens on cells. Because the cancerous cells have a relatively higher concentration of CD47 on their membranes, more anti-CD47 antibodies will bind to them than to healthy body cells, so the tumor cells will be targeted by phagocytes and hopefully eradicated. Anti-CD47 antibody therapy has shown tremendous promise in its trials in mice, and human clinical trials will soon commence.
So as a therapeutic agent for treating humans, there are some challenges that are going to be there because CD47 is present not only on the cancer cells but also on normal, healthy, non-tumor cells. So the potential for toxicity is probably slightly higher than other cancer-specific antibody targets.
In all the studies we have done, we have seen very limited side effects, which is almost just restricted to a transition loss of red cells. So that means you give the drug, and after giving the drug the first time, you will see a drop in the red cell count, but that's transient. So they will come up back, even if you do repetitive dosing. So we don't think that's a major issue. When we looked at all the tissues in the animals we treated, we haven't seen any major tissue toxicity. But from the experience we have so far, we're very, very confident that this is going to be a therapy eventually.